My name is Miguel Alfaro. I am a plastic surgeon. I study medicine in Costa Rica, and I did my residency in general surgery at San Juan de Dios Hospital, which is a 800-bed adult university hospital. And then I went to the United States and I did my residency again in general surgery and in plastic surgery, University of Michigan, Ann Arbor, and then University of Colorado Medical Center. I also did some training in general surgery at the University of Missouri, Columbia, and worked at the Ellis Fischel State Cancer Center, which is a very famous cancer center. And I came back to Costa Rica in 1976, was that, and I started working at the Social Security System at San Juan de Dios Hospital. And I was the chief of plastic surgery. I was the chief of the burn unit. In fact, I created that burn unit with a donation from the private sector of the American U.S. Embassy. And after that, I became the chairman of the Department of Surgery at that hospital, which is a 400 surgical bed department, really large department. And I've been a professor at the University of Costa Rica and also the UCMed, which is a private university, and also WACA, which is a medical school that my daughter studied. I'm in the academic board there. And I work now that I am retired from the Social Security, but I work very actively at CIMA Hospital, which is I'm a founder of this hospital, and it's a hospital approved by the Joint Commission Hospital. I'm on the board of directors too there and the executive committee, and I still work as a professor teaching.
Perfect. It's no secret that medical tourism is definitely making its impact on Costa Rica. Can you go ahead and share your thoughts and your experiences?
Yes, since I came here many years ago, in 1976, I started receiving people from embassies, mostly from the American embassy, and this spread like a word of mouth because when they went back to the United States, they started recommending me, so people called me. I gave them my telephone number at my home. I usually do that with my patients. So they called me and they asked me if I could go to New York, for example, to visit some people. So I went to visit my patient and she had 10 or 12 more friends. I did the same in Atlanta, California, LA, and then in Florida. I used to go to Miami and Fort Lauderdale, Boca Raton, Palm Beach, West Palm Beach, Sarasota, but I don't do that anymore. I have so many people calling and with the internet communication, so there's no need to travel that much now.
Sure.
But this, at the beginning, was a word of mouth. I remember a judge from California, a lady, that came to Costa Rica to have a breast reconstruction after cancer. And we contacted the insurance company, and she asked me the price, and the insurance company asked me, can you give us a price? On that time was $4,000 plus the hospital for one side reconstruction, and then I did the other reconstruction a month after that, and the insurance company were very, very happy. They said because the price and also the facility that we performed the operations. They were very happy because on that time the insurance company told me this reconstruction was going to cost $40,000 in the United States. And in Costa Rica, including the hospital, it was like $5,500.
Incredible.
So it's a benefit of the insurance company. That's how they are now coming here and searching the hospitals, which is very important that they come and accredit the hospitals.
On the note of insurance companies, do you work with insurance companies in the United States?
I do not work with them, but when somebody comes with an insurance in a reconstructive procedure that they recognize and they pay, I work with them, yes. So we send all the information, and that's very important for the insurance company, because that's the only way to bring cost is, at this moment, probably look overseas, because it's impossible to bring the cost down in the United States at this moment. I can assure you I never had any problem. Nobody died in me in the last 36 years that I have been practicing plastic surgery. Of course, I'm very cautious about it. The patient should have a good checkup by her family physician. Is something wrong, to go to a specialist, internist, cardiologist, endocrinologist, have a comprehensive blood workup, and follow all the instructions that I usually give to my patients, communicating through the email. The patients send their photograph and the medical records through the email, and I recommend. So with a green light, it's not advisable. Some people say, well, doctor, I'm traveling, having all the tests done there, which is cheaper here. But then what if something wrong? Then you have to just fly back and the operation has to be cancelled. So it's very important to clear up that. But the hospitals here are very, very high-class hospital. As I mentioned before, the private hospitals here have the approval of the Joint Commission International with all the requirements, and the quality of medicine is great, it's excellent. Something goes wrong, well, the patient will have insurance to cover if something goes wrong, or at least all the medical aspect is not charged for a complication. Just the hospital will charge, of course, obviously, but thanks God we never had any problem like that. I'm very cautious about it. I prefer to cancel an operation. Sometimes it's more difficult to say no, but you have to say no sometimes to avoid put the patient in a dangerous situation. I always recommend the patient to go. I have several. I do not owe the places. I work with them. I send the patient to some hotels or recovery houses. They receive the patient at the airport. They give them a transportation to the hotel, transportation to the hospital, to my office, and I see the patient once or twice before the operation, and then every day or every other day after the operation at the place, or they bring the patient to my office. They have special diets, and they have a nurse and a physician in those recovery places, and they are all well taken care of.
And just recommendations from you, which one?
Yes, I have been working with Le Mas, which is a great place. This was built by a lady that and her husband from California. Also, I like Chetica, which is in the mountains, just 5 minutes away from the city. There is in the hospital Cima has 1 block away, a walking distance, a hospital, a hotel, the Marriott Residence, which is good. Intercontinental is about 6 blocks away, but I like Le Mas because it's better care than Chetica.
And all of these places will have a registered nurse on staff?
They have registered nurse, and they have a physician,
okay.
A general physician that always see the patients and communicate with us. If they need our support, then they will bring the patient to us.
And I know that there's a lot of factors in the question of pricing, but if you could give a comparative to something in the United States versus what you do here.
Well, it depends, because if you go to Tom Rees in New York, or you go to Dallas or Houston or Miami to famous surgeons, I know what they're charging. I will reserve that to me. But for example, for a facelift complete, I'm charging $3,800, surgeon, assistant, anesthesiologist, plus the hospital with 1 day stay, which is between $1,500 and $2,000 at Cima Hospital.